I think we'll go ahead and start now. I want to just welcome everyone um, to our webinar here. This is a webinar that is sponsored by the Prenatal to 3 Capacity Building Hub at Build. And the title of this series is Moving Away from Family Separation, Cross-System Strategies to Support Young Children and Families at Risk of Child Welfare Involvement. This is the first of 6 webinars in the series. This webinar is entitled Two Systems, One Vision, Quality Early Care and Education for Children in Foster Care. I am your moderator. I'm Cynthia Tate, and I'm with the Build Initiative. So I'd like to just frame this series a little bit for everybody and give a little bit of an introduction and overview. So when I started this work at Build, I contacted a mentor of mine, and I said, what I was wanting to do. And so the question he asked me was, well, do you think that the child welfare system can prevent child welfare involvement by itself? And so no is the answer. And but what I want you to know is that this is the large question facing not only the child welfare system, but the larger community of systems that serve children and families. All of these systems have a role to play, and what everybody's doing right now is trying to figure out what that is. Now, what we want to know in particular is how early childhood can be one of those systems that has a role in serving both children currently in child welfare and also working upstream to reduce child welfare entries. The question itself represents a pathway. It represents a progression from where we are and what we can do with the children who are in care to a more upstream approach, doing preventive work. Now, we know that for all children and families, child welfare involvement is best prevented by providing concrete and economic supports. Thank you, Chapin Hall. It is a cross-systems answer. How we focus on entries of children prenatal to 5 also has a cross-systems answer. And it is being developed by organizations from both fields, early childhood and child welfare, working together. We here at Build are working closely with our partners at 0 to 3, in particular, my buddy, Darnisha Allen, who is my personal thought partner in this work, and the entire Safe Babies policy team there at 0 to 3. We also have a group of thought leaders that have been advising us in this work and produced the last series that we did, which includes the Association of State and Tribal Home Visiting Initiatives, Erickson Institute, the University of North Carolina Impact Center at the Frank Porter Graham Institute, the National Head Start Association, Chapin Hall, Casey Family Programs, and of course, Build. We want to thank all of our thought leaders, including those from the states that were represented, including Washington, Illinois, Minnesota, California, and others. So today we are starting with a spotlight on Arkansas. Their work is really significant to start with, because without being able to understand the barriers and the facilitators of access to high quality early childhood programs, we won't be able to take care of the most vulnerable children. And without helping the workforce take care of children who demonstrate signs of trauma, we also won't be able to take care of the most vulnerable children. In this series, we will always prioritize the children, all children, and their parents and caregivers. We are striving to bring you the latest thinking and exciting, promising practices. This work is a journey, and we're inviting you to go on this journey with us. So welcome to the journey. All right, we can bring up the slides and move on. So therefore, the objectives of the webinar series are to raise awareness about young children and their families involved or at risk for involvement with the child welfare system, to educate participants about the racial disparities in family separation from child welfare involvement, to provide examples of cross-systems collaboration on behalf of our youngest children, and to promote opportunities and upstream strategies for prevention for families and communities. Next. Now, for this particular webinar, the objectives are these. First, we will have presenters that will share how they are adapting the Learn, Innovate, and Improve model in order to learn about facilitators and barriers to children in foster care and their participation in high-quality ECE, to use project findings in order to develop and test strategies to improve and increase access, and to use rapid learning methods to improve feasibility and implementation. And then we're going to learn about Arkansas's targeted infant and early childhood mental health consultation project, Project Play. Next. Here are our presenters, and I'm going to ask our presenters if you'll wave when I call your name. We have Nikki Edge at the University of Arkansas for Medical Sciences. Welcome, Nikki, and thank you. We have Sheila Smith from the National Center for Children in Poverty. Good morning. Good afternoon, Sheila, and welcome. Thank you. And Todd Grindle from SRI Education. Hi, Todd. All right, so those are our three presenters. Let's move to the next slide. Now we want to find out, who are you? So who's with us? Who signed on? Who registered for us today? Well, we want you to know that you're 700 people strong. You are from 47 states in the District of Columbia. You're from Northern Mariana Islands, the Virgin Islands, and Bangladesh, Burundi, Hong Kong, Kenya, Sierra Leone, and Peru. We are really international. You are from a number of state agencies, departments of early care and ed, excuse me, economic security, children and family services, health, public health, mental health, maternal and child health, public instruction. And you are bilingual grassroots organizers, you are educators, home visitors, navigators, researchers, philanthropists, service coordinators, developmental therapists, policy analysts, eligibility specialists, EI managers, R&R directors, physical therapists, and trauma coaches. You're from national, regional, and community organizations. So that is very exciting to all of us. We welcome each and every one of you. What we heard from you when you registered was, one of the questions we asked you was, which of our topics were you interested in? And most people said both. But when we split it up, we see that a lot of people are really interested in learning more about the needs of children in foster care. And a lot of people are also interested in information on infant and early childhood mental health consultation. And you can see on the slide some of the other reasons that people were interested in this webinar and hopefully in this series. You can see that people are interested in cross-systems alignment and trauma-informed strategies and reimagining child welfare policy. Next slide. So how do you participate? Well, the first thing is a set of instructions I already gave you, which is to introduce yourself in the chat. So number one, you've already done. The second is to put your questions for the panelists in the chat or the Q&A. What we will be doing as we move along, we have folks behind the scenes that are going to monitor the chat and the Q&A. And then at the end, when we get to the Q&A part, they will give me questions and I will ask them of the panelists. And then the last thing we want you to do is complete the survey at the end. It's a reflection sheet. It doesn't take long, but it's really, really important to us. We ask people at the end of everything we do to fill out reflection sheets so that we can have our fingers on the pulse of what folks are wanting to learn about from us and how we did in meeting your desire to learn. Next. Okay, we will get right into it. This first presentation is Todd starting off and also with Sheila. And so Todd, I'm going to turn it over to you.
Great. Thank you so much, Cynthia. Thank you for the invitation and for all of you coming in and spending some time with us today. My name is Todd Grindal. I'm the co-director of the Center for Learning and Development at SRI Education, and along with my colleague Sheila Smith, we're going to be sharing our work with our partners in Arkansas to improve access to and delivery of high quality early care and education for young children in foster care. Next slide, please. Here's what we're going to talk about. Cynthia previewed this a little bit, but we're going to talk about, from our work in Arkansas, what we're learning about the types of early care and education programs into which children in foster care do and do not enroll. How does this go about happening? How do foster parents engage in the search for programs for their children and enroll them? What are the challenges they experience there? And then I think the important part is we're going to talk about what can we do about it? What are some strategies that we can take that we're working on in Arkansas to increase access to not just childcare, but childcare that is stable and high quality? We'll highlight at the end some things that we think are generalizable to other states that aren't just Arkansas specific. Next slide, please. This project is a partnership between SRI Education, the National Center for Children in Poverty, the University of Arkansas Medical Sciences, as well as the Arkansas Department of Education and the Arkansas Department of Human Services. This is enabled through a Child Care Research Policy Partnership Grant issued through the Office of Planning, Research, and Evaluation at ACF. We've been partnering, this group has been partnering together. I think we're going into our 7th year now. And these are such great programs because what they focus on is to keep researchers from working in the corner on issues that are of interest to them and to partner them with the folks who are out there serving kids and families every day. So our interest in this, our work on this project and our focus on this topic came through a set of dialogues and discussions about what the real needs were for the Arkansas Department of Education and Department of Human Services. Next slide, please. So through those conversations, we heard from folks in Arkansas that there was a lot of concern about what they saw as low enrollment of children in foster care in high quality early care and education programs. We know from other work that because of the trauma and separation from primary caregivers, children in foster care often experience high levels of risk for low outcomes related to their behavioral outcomes, their learning outcomes. And we know that high quality early childhood education can provide that developmentally supportive, stable environment for children in foster care that can reduce the risks that are associated with early adversities. So for example, there is evidence out there to suggest that children in foster care who enroll in quality early care and education programs are more likely to have stable foster placements and experience more positive development and academic and social outcomes, all those things that we're measuring as kids get into kindergarten when compared to those foster children who do not attend ECE. Now, despite the fact that we know there are needs and benefits of doing this finding that there is low participation of children in foster care and high quality ECE is something that we've seen before. So we hope in this project to both understand how is that playing out, why is that happening in Arkansas, and then what can we do about it? Next slide. Again, this is not a project where we are seeking to obtain knowledge for knowledge's sake. We want to learn in partnership with the state agencies and the other folks who are serving children and families, identify ways that we can do things a little differently, test those out, see how well those are working, and then go back and continue to iterate that in this learn, innovate, and improve cycle. So we are just coming out of our learn phase, moving into the innovate and improve phase. I'll share a little bit about the learn part, and my colleague Sheila Smith's going to talk about what we're doing to innovate and improve. Next slide. We're looking at this from a lot of angles. So we have rich sets of administrative data, licensing data, voucher authorization data, data on who attends programs where. We have information from licensed childcare programs from Head Start, also information about foster families and foster children from the Division of Children and Family Services. So we have all this administrative data where we can look at these connections. But you can only learn so much from those kinds of numbers. So we're spending a lot of time talking with foster parents via focus groups. We're talking with center-based directors of early care and education programs, both that family home programs, both those that do and do not serve children in foster care. Talking to folks in faith-based programs, child care resource and referral agencies, as well as those agencies that are partnering with foster families to support their foster training and other needs. In addition, we're going to share a little of what we've learned from surveys of foster parents in Arkansas. And we pull that all together to try to get some insights on some of these core questions. Next slide, please. So the first is that, consistent with what's seen in other places, the participation of children in foster care in ECE is low. It's less than half of children in foster care, this was in the year 21-22, used a Child Care and Development Fund voucher to attend preschool. So they all have eligibility for this. They can all use those vouchers. And we're seeing less than half are taking that up. It's about 1 in 5 of children in foster care are enrolled in early intervention day treatment programs. That was a little bit of a surprise to us, and something that I'm curious to hear from others about their experience in their states, whether they're seeing a similarly high participation in EIDT or other type programs. And we thought relatively low participation in the state's preschool program, the Arkansas Better Chance program, or in early Head Start and Head Start. So first finding was we are seeing this less than half of foster kids are able to take advantage of that CCDF voucher and enroll in childcare programs. Importantly, when they do enroll, we are seeing that the programs that children in foster care are enrolled in are of lower quality, as measured by the state's quality rating improvement system, than their peers who are accessing vouchers but are not in childcare. So low rates of participation. When they are participating, they are more likely to be in the lower quality care as rated by the QRIS. Next slide, please. When we talk to parents, either through the surveys or through our interviews, childcare, early care and education is not a nice to have. It is really a must have. We see more than 9 out of 10 families tell us that we need foster care or we need childcare for our foster children so that we can go and continue to be employed outside the home. There are smaller percentages who are seeking this to get access to supports or other educational benefits, but this core need of I can't go to work and take care of my foster children at the same time without support from ECE. Next slide, please. Foster families tell us that by and large, they're on their own in this search. And think about the context for in which they're engaging in searches for childcare. So foster care placements don't come on the regular childcare enrollment schedule. Often it's a call on a Tuesday night and children there on Wednesday morning. These need to find care quickly. Although some do get recommendations from caseworkers or other nonprofit organizations, that 31% who said they received some recommendations from caseworkers, often that's not all that helpful. Sometimes they tell us the advice is, well, go to the website and search their website, and then they've got to find programs that have a sufficient level of quality to serve children in foster care. They've got to contact those programs. It's a lot of work. And by and large, these foster parents are on their own in engaging in this search. Next slide, please. The biggest issue they talk about, or that they share with us, is that immediacy. Can I find an opening right away? And can I find a program that accepts vouchers? The challenges in doing this, we heard from more than 8 out of 10 of foster parents said that challenge of finding a place that is open, finding a place that will take their voucher, led them to experience some form of hardship. They missed work, they experienced some financial strain. I'm going to pass to Sheila now to say a little bit more about what we learned from our conversations and how that plays out in terms of access both to early care and education and to foster care. Sheila?
Thank you, Todd. Hi, everyone. I'm Sheila Smith from National Center for Children in Poverty. And I'm going to turn to a few themes that came out from our focus groups if we go to the next slide. So first, we learned that foster parents really struggle with the early care and education choices they have that may not include high-quality programs. And as you see here, as an example, one parent told us, it's like we have biological children and then we've had foster children, and sometimes it's like if that was the only spot that they have in a daycare setting that takes those vouchers, would I send my own kids there? No, sometimes you're just kind of between a rock and a hard place. Another parent told us, you have extremely low standards because you don't have any other choices, which is sad because we have to work. And we heard the same kind of concern from many foster parents. Next slide, please. A second theme that we heard from both parents and ECE directors was that serving children in foster care really requires expertise in trauma-informed care. So one parent said, well, we do have a lot of programs that take many foster kids, but they're not generally trained in trauma. But they have a bigger heart for it, so they may not know exactly what they're looking for, but they don't freak out at all the behaviors. But most of them, most of the providers are untrained, freak out, and discipline. Most of the time, it's like, you got to come and get them. And then a director told us, I love these babies, but I'm going to be the first to continue to say on a broken record, I'm just not equipped. We need some mental health people in this building. We need trauma sensitive training. And I'll just remind you that Dr. Nikki Edge will really be talking about this challenge and providing some great resources in her presentation. Next slide, please. Great. So given all the challenges that foster parents face in finding ECE for their foster children, it may not be surprising that foster parents must sometimes turn down a request to take a child when they have a concern about finding childcare. We're surprised to learn how often this happens. More than a third of foster parents reported that they had declined a request from DCFS to place a child in foster care in their home because they were concerned they'd be unable to find child care. And out of those who declined, 42% reported declining placements 4 or more times due to concerns about child care availability. Next, please. So as we were learning about the challenges facing foster parents who need ECE, we also tried to learn resources that might help address some of these challenges. And we learned that many members of the faith-based community are involved with the state's Every Child Arkansas initiative. And this is a project that's really working to recruit and support foster parents. We conducted a focus group with faith-based ECE providers who could potentially become eligible to enroll children in foster care if they accepted vouchers and participated in the state's QRIS. The faith-based providers told us that they would very much like to enroll children in foster care, that doing so would align very well with their mission of serving families in their communities. But they had some concerns and really saw some barriers. And these included a worry about adhering to a different non-faith-based curriculum, hiring outside the faith-based community, financial strains their programs might experience related to voucher payments and rules, and meeting standards set by the state's Better Beginnings QRIS. Next, please. Another untapped resource we learned about was the Arkansas Child Care Aware system, the set of CCR&Rs around the state. There are 5 regional agencies and 14 local offices across Arkansas. And in a focus group with CCR&R directors, they really expressed a lot of enthusiasm about some more targeted efforts to help foster parents find quality ECE, including a willingness to contact programs for parents, really taking a lot of the burden off foster parents. So in the summer, this past summer, our research team and state partners met in person to discuss study findings and really try to formulate some strategies we could pilot during this next phase. These meetings involved all of these partners, and having them in these meetings thinking about strategies really resulted in some very productive ideas. So we'll look next at the strategies that were developed during these meetings and some ongoing conversations. If we go to the next slide. The first strategy that we decided to try to test in the coming year is to partner with Child Care Aware to help foster parents search for high quality care. And some of the components in this strategy are to provide information about CCA to foster parents, including during the trainings they're mandated to participate in, to establish some processes for referrals from caseworkers to CCA to enable them to proactively reach out to foster parents and offer assistance, and also to encourage CCA to help foster parents access Head Start and Early Head Start, and also state preschool programs, which tend to be among the highest quality in Arkansas. The second strategy is to support faith-based child care providers in efforts to become eligible to serve children in foster care. And this would involve providing information that dispels myths about accepting vouchers and participating in QRIS, including information that lets them know that there's really a lot of flexibility in the content of their curriculum and some other requirements, and to offer TA from a specialist with experience helping faith-based providers. Next, please. So now we just want to suggest a few steps you might consider taking in your state. Next slide, please. First, you might try to learn more about young children in foster care in your state and their participation in ECE, whether they're in high quality programs, inclusive programs, and Head Start, Early Head Start. You might want to check with your Head Start collaboration director about obtaining the Head Start PIR report, which will show you how many children in your Head Start programs are children in foster care. You could partner with organizations that work with foster parents to learn about barriers faced by foster parents in finding ECE and the kind of assistance they're currently getting. And learn about strategies already being used in your state or community for quality and trauma-informed care, and how these could be expanded. Next slide, please. An important step would be to shine a spotlight on the benefits of access to high-quality ECE for children in foster care, especially if you have a concern that this issue really needs more attention in your state. And last, it's clear to us that all of these steps can benefit from new opportunities for ECE and child welfare agencies and other partners, including the foster parent community, to really work together to collaboratively learn and innovate and try out some new strategies. So I will just end here with the next slide, where you will find our contact information. And we are eager to learn in the discussion a little bit later on whether some of these partnerships already exist in your state. And I will turn it over now to back to Cynthia. Thank you so much.
Thank you. Thank you both, Dr. Sheila Smith and Dr. Todd Grindal. A lot of good information there, and also lots of good suggestions. So I hope everybody is making a note to see if there's some suggestions that that are being made that you can pick up on, because we're always asking people, what can you do when you go home? All right, so now we're going to shift gears and hear from Dr. Nikki Edge, who is going to talk, as we said before, about infant and early childhood mental health consultation and very, very important support. So, Nikki, it's yours.
Thank you. It's so nice to be with you all today. Such a big and diverse crowd. I'm going to share my screen. And if somebody can give me a thumbs up and let me know that that worked as intended. Perfect. Great. So I'm going to talk in particular about reducing expulsion risk of children in foster care through infant and early childhood mental health consultation. And because that is so many words to say, I'll probably just say mental health consultation. And at least, get a few of those words out of the way. I'm here representing a group of colleagues who work and study on these issues, including my colleagues Angie Kaiser and Maya Williams. So many of you who've been looking at the literature on preschool expulsion remember that it's been about 15 years now since Walter Gilliam first kind of highlighted the problem of preschool expulsion and the disparities in the expulsion data, particularly impacting boys and especially boys of color. And since then, we've seen federal guidance that's been encouraging states to take action on this issue. And we've seen a lot of state and local policies pop up to try to reduce the impact of preschool expulsion on children and families. And yet, research tells us that it's still unfortunately common, and meaning all of our kids are not able to experience the benefits of high quality early care and education. Now, Dr. Gilliam's early work also suggested that mental health consultation was associated with decreased likelihood of expulsion, and that has been confirmed in studies since that time, as well as a number of studies which show different benefits of mental health consultation, like improved teacher-child interactions and reductions in challenging behaviors in classrooms. So we have learned a lot in the past decade and a half, but we have a lot left to learn. And one area where we have to go deeper is exploring variations in mental health consultation outcomes associated with different conditions in which it's delivered, different policy landscapes, different populations of teachers and children. And in particular, we're interested here today in children in foster care. So as Todd reminded us in our presentation just a minute ago, kids who've experienced trauma are at higher risk for delays in social and emotional development and at higher risk for early emerging mental health concerns like post-traumatic stress disorder. Sometimes these concerns manifest in challenging behavior in the classroom that becomes difficult for teachers to manage. So not surprisingly, there's some research suggests that young children who've experienced trauma are at increased risk for expulsion from early care and education settings. In addition, Todd and Sheila and their colleagues have helped us understand from research here in Arkansas that when teachers attribute behavior challenges to factors associated with family life, they are less likely to seek help in managing that behavior. And so we think about that a lot when we think about the family life of children in foster care and what teachers see as their role in addressing that. And then we also just heard from Todd and Sheila that children in Arkansas in foster care are less likely to experience high quality early care and education. So when we think about all those factors together, it would seem that children in foster care would experience some unique risk factors for expulsion. And so that's really part of what we wanted to look at. We have described in prior studies of our work here in Arkansas how we've used mental health consultation to support children that serve lots of children in foster care through programmatic or classroom consultation. But there haven't yet been studies here or elsewhere that have explored expulsion-related outcomes in the context of mental health consultation. And we really can't assume that mental health consultation would yield similar benefits for children in foster care as for other children, given the higher number of traumatic experiences, the lower access to high quality care, and the potential that their teachers may feel less equipped to support their needs. So that's what we wanted to explore. We wanted to explore process variables and outcomes of mental health consultation for children in foster care compared to children not in foster care in the context of our mental health consultation program in Arkansas, which is part of a bigger expulsion prevention system. So a little bit more about our policy context and our state context. Very proud to say that around 2015, Arkansas decided we needed to take some steps to reduce exclusionary classroom practices in ECE in Arkansas, and we established an expulsion prevention work group to look at policies and supports that we could put into place. We did a lot of things, but a couple of the most important things that we did was expand a policy that says that ECE providers who accept state and federal dollars for the care of children shouldn't expel them without asking permission from the funder. And between that rule and the regulations that govern Head Start and Early Head Start, we've got about 75% of childcare in Arkansas covered by some policy that seeks to reduce expulsion. And so we knew, though, that you can't put a policy like that in place without offering support to providers for the very real challenges that they face in their day-to-day work. And so we designed a system called Behavior Help to support teachers and family when there are behavior-related challenges in childcare. This is a very busy slide. You don't have to try to take it all in. I'll highlight a few key points about it. Our Behavior Help program provides a single point of entry for providers who are experiencing challenges with behavior and children who are at risk of expulsion. It's a 3-tiered system with 3 partners, our funder and our amazing partner at the Office of Early Childhood. They handle the referrals that come in, and they also support cases that are kind of a lower level kind of behavior concerns that are happening. The majority of referrals that come into our system are handled by a wonderful team of technical assistance providers at Arkansas State University who support children and teachers by working on enhancing classroom practices that will benefit all children, but especially children that are experiencing challenging behavior. And then our Tier 3 cases come to mental health consultation with a program here at UAMS called Project Play. We respond when referrals come in and the interview indicates that the behaviors are particularly severe, maybe developmentally atypical, or there's already multi-system involvement, the child has known trauma, something is telling us that this would benefit from support through a mental health lens. And so foster care involvement is a reason for a Tier 3 response. And so all the analyses that you're going to see today are cases that came to this right-hand side of the graphic, Tier 3 supports here for mental health consultation. So what does that look like and what do we do? So let's see. Mental health consultation in Arkansas involves pairing a specially trained mental health professional with directors, teachers, and parents to build their capacity to support the child in the classroom. So we operate when we have child-focused cases like this in a 3-month partnership with weekly visits where our consultants spend the better part of the day working alongside teachers and directors and meeting with parents to help kind of learn what's going on for the child, observe, kind of understand a picture of what the struggle is in the classroom, and develop a really comprehensive plan to strengthen relationships, build social and emotional skills, address childhood trauma, and think about really safe ways to address behavior in the moment, and do a lot of thinking about other referrals and supports that families may benefit from. I want to spend a few minutes talking about a few features of mental health consultation that particularly come into play when we're talking about children in foster care or other children that have experienced trauma. As you saw from some of the quotes that Sheila shared, one thing that we know is that information about childhood trauma is not always part of the background and training of early childhood staff. So some consultants will note that teachers haven't yet connected the dots between the child's experiences of trauma and some of the behaviors or challenges that they are seeing in the classroom. And so having more information about that can help them see it through a different lens, give them a broader array of responses, or just increase their empathy or willingness to work through challenging times. So we try to work on a lot of things with the teachers and directors that we're partnered with. One is to respond to behavior in ways that's safe and avoids re-traumatization. So focusing on de-escalation, focusing on helping teachers keep their cool. We also work a lot on techniques to build and strengthen relationships between teachers and children. We focus a great deal on creating emotional and physical safety in classrooms. So supporting kids with strategies to help make their worlds more predictable and consistent, help them know what's coming next in the classroom so that they can transition through each set of activities more smoothly. We focus a lot on helping teachers equip children with skills for self-regulation. So when we think about trauma, by definition, trauma means that we have experienced events that have overwhelmed our capacity to cope. So helping kids build coping skills, helping them understand how to identify their emotions, how to calm down from big feelings is a key piece of the work. Building social skills. So some kids may not have had great models for conflict resolution, for problem solving, for friendship skills. And of course, we know that those skills can be taught in a high quality classroom. A key role of a mental health consultant is to support the well-being of ECE program staff. And in our experience working with cases of children in foster care, this becomes particularly important to keep in mind. We know that working with children in foster care can be emotionally challenging. For some teachers, it may be just, kind of trying to rebuild their empathy to work through challenging behaviors. Other teachers have difficulty understanding the mission of the child welfare system to reunite families whenever safely possible. Maybe they feel anger toward a parent where there was maltreatment, or they might find themselves taking sides in their minds in a child welfare case and need a place to process that. They may be carrying a lot of worry for a child who may be about to transition out of their program, and they don't know what's happening next for that child. So being mindful of the emotional load of these cases and giving teachers a safe place to work through some of these issues is an important piece of the work. Another thing I want to highlight, because this is something any of us can do in our states with the support of our child welfare and early ed systems, is help work through cross-system communication challenges. So one thing that we learned long ago is that there are big communication challenges for ECE providers who are serving children in foster care. Very unintentionally, they are often left completely out of the communication loop about what's happening in a foster care case. They tend not to know enough about the history of the children that they're serving, special needs that they may be needing to support, medical needs that may need support. They don't know what's going on often in the life cycle of the case. Are we nearing reunification? Is this case coming to adoption? What's happening? Is there a transition? They don't know about schedule changes like visitation and court and appointments. And it often leads to daily disruptions in the life of the child and in the program. So we worked a number of years ago with our two state agencies, Child Welfare and Early Ed, to develop a communication toolkit that ECE and child welfare teams could use when they're working together to meet the needs of a child in foster care. One of the most important elements of the toolkit is really the simplest, and it's just a letter from these agency leaders to say, we support the sharing of information in the best interest of the child so that you can serve the child well. Not everything has to be a secret just because the child is child welfare involved. Then we give tips for the kinds of questions that it's appropriate for ECE providers to ask. We give them tools for sharing their updates with the court and with caseworkers. We give tips for how to support children through transitions that may inevitably happen when a child needs to leave a program. So, these are things that sometimes we don't think about, but that could be really important for kind of smoothing out some of the bumps in the road when programs are trying to serve these children well. All right, so that's the context, that's the services, that's the support. And so we really wanted to know more about how it's working, particularly for children in foster care, and whether our system is able to support them as well as we're able to support other children that we serve. And so for this analysis, we're exploring the outcomes of about 500 cases of kids referred to our expulsion prevention program and receiving services specifically in that mental health consultation arm, and focusing in on data that we gathered before and after a consultation from teachers and consultants. And we gathered lots of data, and if there are probably only a few researchers in the audience who would like to hear about all of it, so I'll just hit some high points. That we gather information about the children and the center that they're serving from an interview that comes at the initial referral. We gather data from the mental health consultant about the outcomes of the case, and from the teachers about ongoing expulsion risk. We gather data from the consultants about their perception of how did people engage in the process with them? How willing and receptive were ECE providers to engage in the process? How involved were parents or other primary caregivers? And then we gather data pre and post consultation about children's emotions and behaviors using the Strengths and Difficulties questionnaire. We explored differences in children in foster care and children not in foster care prior to consultation. And then we explore process and outcomes differences for children in foster care and not in foster care. And then we used multiple regression models to explore the impact of foster care status as a predictor of our post-consultation outcomes. So who were we serving? Our referrals were mostly from center-based programs, and they were about 60% at the highest level of the quality rating system that we had at the time. Our services were provided by 19 licensed or license eligible mental health professionals. And here's a little data about the children that we were serving, the whole sample of 500 children who were receiving mental health consultation services. So you can see that we tend to serve older preschool children, but we also have infants and toddlers. Consistent with national data, our referrals are overwhelmingly for boys. And then our race and ethnicity breakdown about matches our enrollment in our publicly funded childcare. And then, of course, we're going to be looking more closely at that 15% of referrals who were in foster care at the time of referral. And you can see just from that number, obviously 15% of children in ECE programs are not in foster care. So these kids are overrepresented in our expulsion prevention system. So the first thing we did was just look to see at the outset of consultation, are children in foster care similar to children in not in foster care that were referred for consultation services? And the answer was on most things, yes. So on age and gender and behavior and expulsion risk, they were similar. They were different in a couple of ways. One is that the majority of children in the sample were white, but children in foster care were a little bit more likely to be non-white. And consistent with what we've learned from Todd and Sheila, our children in foster care were more likely to be in lower quality programs, both based on the quality rating system and based on our observable measures of the quality of social emotional supports, red flags in teacher-child interactions, like using harsh tones to manage challenging behaviors. And we controlled for some of those differences in our subsequent analyses. So as I described earlier, cases come into Project Play because something about them suggests that it's a more serious situation. And in fact, that turns out to be true. On standardized measures of children's emotions and behaviors, about 88% of children are rated by their teachers as falling into clinical range on these screening tools, meaning that there's some very serious challenges happening in those classrooms. But fortunately, we do see significant improvements in challenging behaviors, the frequency of behaviors as rated by teachers across the course of consultation, and improvements in pro-social skills. We also see teachers' feelings of hopelessness and stress about the behavior decrease over the course of consultation. Now, so then the question is, does it work equally well for children in foster care? And by and large, it seems that the answer is yes. So first, we looked at how people engage in the process of consultation, and we found that levels of engagement, willingness to be very active in the process to support the child to try new things in the classroom were very similar for children in foster care and not in foster care. Our expulsion rates were exactly the same across groups, with a little less than 5% of children in either group being expelled. And foster care status was not a predictor of post-consultation measures of child behavior or ongoing expulsion risk. And so that was very good news for us. So I'll just kind of wrap up and summarize by saying that, over the past 15 years, we've learned a lot about positive outcomes of mental health consultation, including reductions in behavior concerns in classrooms and improved expulsion outcomes. As we've been discussing, we couldn't just assume that similar benefits would be seen for children in foster care because of the number of traumatic events that they've experienced, because they have less access to high quality care, and because their teachers may feel less equipped to meet their unique needs. However, these findings do suggest that mental health consultation may be able to be utilized to support children in foster care as effectively as other children that are also at risk for expulsion. And it may be a really important service to improve outcomes for children in foster care. Now, I do want to note that these findings are very unique to our tiered system of supports. So we're comparing children in foster care to other children who are at high risk for expulsion and who were deemed in need of our most intensive tier of support services with mental health consultation. So whether we would experience these same exact findings in a different context is a different question. Nonetheless, we feel very encouraged by the data that says we're able to effectively support children whose relationships have been disrupted and who are so especially in need of warm and supportive early care and education experiences. And so I'll stop there and turn it back to Cynthia, who will take it from there.
Thank you, Nikki. That was great. That was really informative. We've had a lot of comments in the chat and the Q&A on how helpful and informative that was. And the same for our earlier presentation. Right now, what we're going to do is just spend a few minutes, only 10 minutes or so, doing a bit of just a panel discussion before we get into the questions and answers from our participants. So what I'd like to do is to pull out themes from both presentations and then ask you guys to just kind of, address them from whatever your perspective is. One of the things that I hear that was very clear from both of your presentations was the need for support for the people who are taking care of the children, whether it's the foster parents needing support finding, childcare or other early childhood experiences for the children in their care, or educators in the classroom and other staff, all the staff that are either in a classroom or in a home setting, or in whatever setting the early childhood experience is occurring, needing support too. Because what I don't ever hear is anybody saying, we don't really want to do this. What I always hear is, we want to do it, but it's hard and we're not prepared and we need support. So I'm just wanting to, put that on your minds and ask you guys what your response and reactions are to that.
I'm happy to take a first crack. So thank you, Cynthia. And I see in the chat there are several persons on this call who themselves are foster parents. It is such a important and all-encompassing service to provide. And there are so many things that can only be done by the foster parent, that providing that warmth, that sense of safety, security with the children. We think it's important to take those other burdens, those things that could be done by other people, like facilitating access and finding childcare programs that are open, have slots, will take your voucher. Let's take that off their plates so that they can focus on the things that they are uniquely enabled and able to do. So that's a lot of what we've done in our strategies, is said there's too much of the burden in finding childcare, too much of that sits with the foster families themselves. Other people can help with that.
Great, thank you.
Yeah, I think that there's so many opportunities for support. I'll say just a couple more words about need for support with communication. So when we first developed our communication toolkit, we interviewed 40 childcare program directors who were serving the largest number of children in foster care based on voucher data. There were places where children, 20, 30, 40 children in foster care were naturally clustering in a childcare program of someone who just had a huge heart to connect with this community and provide these supports. And they would tell us stories like, you know, these kids just disappear from our lives. They said the kids have started, I will never forget one director telling me, the kids have started to figure out that if a trash bag full of clothes comes in and sits in the hallway, one of our friends is disappearing today. And they don't know what that means. And so just heartbreaking stories that tell us, like, we've got these are solvable problems. You know, with support, we can get ECE providers in the know about cases of children that they're working with. We can help them know the questions it's okay to ask. We can help caseworkers know that it's okay to tell. And this is all permissible stuff. And then two, to your point about everyone wants to, this is what we hear consistently. Nobody's wanting to expel a child in foster care, a child that's experienced trauma. When that's on the table, it's because they don't feel equipped. And so, you know, mental health consultation is not the only solution. Training is a big part of it. There are technical assistance is a big part of it. There are many, many solutions, and we need them all.
Thank you, Nikki. Absolutely. As you were talking, I was thinking about a case of a very young child that I knew about when I was at the department, and the child was like 5 years old and had been moved 5 times or more already, and we were just all like, you know, completely upset. And what we found out is that one of the reasons that the child moved so often was because of this lack of communication between the caseworker and the foster parent. And it wasn't just the caseworker just like didn't know the history or didn't, it was because the caseworker was afraid if they told the history, they would lose the foster parent. So, you know, there are reasons behind everyone's behavior in a complex system, right? And so it's important, I think, toward collaboration, that we have this understanding or at least make an assumption that everybody is working with best intentions, but there are aspects of the system that keep you from doing what you would ordinarily do, or you know what is available to you to do. I don't know if that stimulates any more comments from any of you guys. Sheila, you came off mute.
Yeah, made me think about the whole question of stability when we are successful helping a foster parent find a high quality setting for the child. We really would like that child to be in that setting as long as possible. And yet we heard for a whole variety of reasons that often children, you know, suddenly are taken out of that care setting because of reunification or because they're moved to a different foster care setting. And usually when we ask, there hasn't been any consideration at all of the possibility of the child staying in that setting. Sometimes there are really insurmountable barriers like, you know, geography, the reunification, the biological home is too far away. But sometimes it might be possible, and the very first thing that needs to happen is just a discussion about the importance of stability when it can happen and what it would take to keep a child in a setting, because all those benefits we've been talking about will be multiplied if the child can stay in that high quality setting and experience that consistency.
That's such a good point, because the instability is one of the main things that causes additional trauma to children, right, once they're in the system. And so if we could provide some stability through the early childhood system, that would be great. That would be great. But that leads me to the second major concept that I wanted to pull from both of your presentations together, which was around this issue of collaboration. I mean, it is part of our title, Cross Systems Collaboration to improve outcomes for children. But both of you in your presentations, all three of you in both presentations, talked about the importance of collaborating with various players in the system, between the foster parents and the CCR&Rs, to provide some help and support that they might have, that might not have been a role that a CCR&R had been playing before. Or, also with the your state partners, your state partners, and we have a lot of representation here today from folks who work in a number of different departments within state government. And so it's important, obviously, to collaborate, but I would like to hear from you guys, some ways in which you think the collaboration is, or some instances in which it is so critical, and then ways in which you think that people can work on collaboration from wherever, like I always say, work on it from wherever you sit. You may not be sitting at the top of that organization, but you can still work on collaboration from wherever you sit. So if you guys have any thoughts about, how people can work on collaboration and why it's so critical, or examples of it being so critical.
I'll just jump in first and say that Arkansas is a small place, and so sometimes I think that collaboration is a little easier for us here. And it has also helped at times that some of the teams that we're trying to pull together have at times been part of the same Department of Human Services. That's not true today. Our Office of Early Childhood sits at the Department of Education now. But again, we're small and well connected. And I think that we've had a lot of success in bringing people together by just sharing information they didn't have. Like when we first started talking to child welfare about the challenges of early care and education, we learned many people in leadership and on the front line didn't know that there's variation in levels of quality in ECE. They think about licensed care as appropriate care. Didn't know that there are programs that offer, much more comprehensive services than others, like Head Start or Early Head Start. This isn't their field. So sometimes we have to just remember that they need a little insight into the world that we live in to understand how we can help them meet their mission. And so once they understood, they're like, come train us, come tell us. Of course we can enhance communication, and of course none of these things are easy. We developed that communication toolkit many years ago, and then it'll sit on a shelf for a year and we forget about it, and the field has turned over again. We have to retrain, right? And so it is an ongoing challenge, but I think sometimes just remembering that we don't know each other's worlds, but that if we can get to somebody who's a decision maker and share a little information, often those lines of collaboration open up.
Yes, absolutely. Nikki, we're getting some questions about whether or not the toolkit is available.
I can put that link in the chat. It's just available on our Project Play website for our partners to use, but you're welcome to peruse it and see if it provides inspiration. I will say one thing about it, which is that this is probably in the cover letter, but it's not meant for someone to pick it up and fill out the whole toolkit and use it. It's meant to provide inspiration. Like there's a whole information exchange form that's not really meant necessarily to be passed back and forth, but that's meant to say, these are the kinds of questions that it's okay for you to ask a caseworker, and that it's okay for a caseworker to answer. So, just use it for inspiration.
Well, that right there is a huge thing. Just getting some guidance around what's okay to ask and what's okay to be answered is huge. So that would be wonderful. Todd or Sheila, I didn't know if you guys wanted to talk a little bit about collaboration.
Yeah, thank you, Cynthia. I'll add one thing.
Okay.
Agree with everything that Nikki said. I think we all know that collaboration is based in relationships. It's a relational activity. We get to know one another. We establish trust. We have ways of sharing information. One of the challenges is that people in this field do change jobs. Caseworkers come and go. People working in a part of an agency move, and our challenge as we've moved forward is to say, how can we make sure that collaboration continues as the people change? How can we build collaboration into the system. We talk to folks and say, oh gosh, you know what? We did this about 10 years ago, but then so-and-so moved to a different job and then this changed. And so we've got to try to both understand that, yes, this is based in person-to-person relationships, but also systematize it in some way.
Yes, yes, good. Thank you for that.
The only other quick thing I would add is that I imagine so many folks attending this webinar are involved in different early childhood professional groups or policy planning groups. And child welfare isn't always at the table, or they just, they're just not part of those groups. And so one thing to do if children in child in foster care haven't been a topic much in your circles and that you're spending time in, and if the child welfare folks haven't been at the table, that's a real opportunity to kind of, as we said earlier, shine the spotlight on the benefits of early care and education for these children, and then begin to invite folks from that system to your system.
Yes, that's a great suggestion. And it is reflective of what I think is one of the most important aspects of collaboration, which is the personal relationship part. So one of the things that we found out when we were doing, we have a thought leaders group that we talked, that I mentioned earlier, and looking at some of the work that's being done in states. The work that seems to move forward and be really successful is the work where the people in the early childhood and child welfare agencies meet and talk to each other personally, that they know who to invite to the meeting, that they have that they learn a shared language, because these two systems don't talk the same language. I remember saying in a child welfare situation to a pretty high up person something about home visiting, and that person said, well, all of our caseworkers do home visiting. And well, yeah, but we're talking about this thing. and so, we don't speak the same language. We don't call things the same thing. We have to get to know each other, and we have to build those relationships so that we can learn the same language, and then we can move forward together in a way that a collaboration that is, meaningful, and also a collaboration that is, but I'm thinking of the word resilient, but I'm thinking that, as you do collaborative work, problems come up. I have a colleague that always said that this work we were doing was all problems all the time, and problems will come up. And if you have a relationship, then that makes you more able to respond to the problem, together, and less, less inability to respond in a productive and fruitful way. Let me say that. So I'm going to just, let's see, do I have any questions? Bill, folks, you got any questions for me from our audience? One of the questions is, what are the qualifications? This is for Nikki. What are the qualifications of a mental health consultant?
So our mental health consultants are licensed or licensed eligible mental health professionals. They vary, social workers, licensed counselors. And then because Arkansas is not a state that has had a huge infant mental health tradition, we don't always have mental health professionals with an infant mental health endorsement, for example, or lots of experience in early care and education, or knowing what an early childhood classroom looks like. And so they do about 40 hours of training before they go into the field that is about the landscape of early care and education, good classroom practice, filling any gaps in their knowledge of young children's development, et cetera. Then we have, then they are partnered with experienced consultants, and they do shadowed and work under a mentor. All of that culminates in a state certificate as a mental health consultant, as a state certified mental health consultant to childcare. Usually takes about a year to achieve, but much of that year they're working under mentorship and supervision. So that's kind of the process we use in Arkansas, different in different states.
Great, thank you for that. So one of the questions that we have is around parent engagement. And I was listening to, we did a special training on trauma for providers a couple of weeks ago. And they were talking about the importance of sort of being the ally to the parent when you're both dealing with a child in a setting who is demonstrating signs of trauma. Can we talk about, in however you want to approach it, you'll be approaching it differently, this idea of family engagement, whether you're engaging the family of origin or you're engaging the foster family, doll family, they're all there for the children. What are your thoughts about family engagement in this context?
It's so important when we're talking about meeting the needs of children in foster care. I think early care and education providers have a very special role to support foster parents, to support biological parents, to support the transition when children are being reunified. And what we know is that when children have challenging behaviors, a lot of times those relationships break down. And maybe a lot of the communication is flowing one direction and it's feeling a little overwhelming to the foster parent. They're hearing day after day about the challenging behaviors or being asked to pick the child up, or those kinds of things. And so that is a key role of a mental health consultant, is bridging communication, helping people be in a room together and holding the different perspectives, and making room for the different perspectives to be shared. Including the child, speaking for the child whose voice is often left out, but also speaking for the parent and the teacher. I mean, they all are having, their own experience of this situation, and finding a way to bring that together and bridge that is a huge responsibility in mental health consultation.
Yes.
In our conversations with foster parents, we reported a lot of the challenges, but we also heard some amazing stories about childcare providers across the state. People who were working with foster parents, not just to support specific children, but understood their role as foster parents, people who would hold slots, who they could text on a Saturday night, and they'd find a place for them on Monday morning. And so we talked to many of those persons and say, tell us about that level of engagement with families. And by and large, these were people who were mission-driven people. And that mission came from a lot of places. In some cases, from their personal experience, from their faith, from other things they wanted to see in the world. But they saw this supporting children in foster care and working with their parents as part of their mission as a professional. And goodness, when a foster parent, they'll tell us, well, everything's fine for me because I know, Mrs. Jones, and Mrs. Jones is always going to come take care of me. The problem is that there's just not enough Mrs. Joneses to go around. But that collaboration, coordination with foster parents, both on specific children and across children, really seem to be valuable for a lot of parents.
Yes, thank you for that, for sure.
I'll just chime in with one other thing that came to mind, which is that one of the reasons I think Head Start and Early Head Start is such a brilliant place for children in foster care to be is that inherent in the mission of Head Start and Early Head Start is parent engagement and is two-generational support. So when you think about, if I think about a child who's maybe transitioning back home to biological parents, having that center, wrapping around and providing support and engaging that family and helping that parent with their educational goals, helping them with their, practical needs, like that's just such a critical support.
Yes, all forms of support are necessary, but even more so when we are talking about supporting children who have trauma in their backgrounds. And I'm going to say this too. by the way, that children in foster care are not the only children who have trauma in their backgrounds. And sometimes we, forget, and I don't want us to forget that, because we are often looking at behavior that is the result of trauma in a child that we don't expect to see it. And so it's so important for all of us to be prepared and supported, prepared, trained, and supported.
Yes. Thank you for saying that. And I will say that 50% of all the children referred into the behavioral health system have a trauma that we know about.
Yes.
And 70% of those that come for Project Clay mental health consultation services. And that's just what teachers and directors know about.
Yep, absolutely. We've got some a question here about grandparents. And we know that often grandparents are the informal foster parents. So the parents are unable, for whatever reason, to care for their children, and their grandparents take them. We know that this is also something that many cultures practice, and is the way that things are done. And it doesn't mean that the parents themselves have to be disparaged or even criminalized. To just the way that things get done when parents have a rough time taking care of their kids. But I'm wondering if you guys have any thoughts about the particular needs of grandparents in these systems, and how it's not always the easiest thing to reach out and find them, because they might not be a part of the formal system. But do you have any thoughts about what the particular needs of grandparents might be? Sometimes we would talk to, I'm going to keep talking unless one of you guys comes up with a thought, but, we would often, when we would encounter grandparents that were formal kin caregivers, right? Home of relative care was called at the time. And would try to include them like in a nurturing parenting program or something like that. Responses might be, I don't need to do that. I've already raised my kids. I know. And so it's kind of hard and challenging to suggest to a grandparent that support might be helpful. It's a sensitive kind of situation. So I'm just wondering if any of you guys have had any experience with that or thoughts about that.
It's not a direct focus of our work, but we
Yeah.
did learn that it is not uncommon for kin care providers to be unaware of all of the benefits and services that they have access to because of their child's status. And so we do see that there are some potential information gaps in that space. But Sheila or Nikki, I invite you to add more if they're related to grandparents in particular.
One thing that comes to mind is that, more and more states are moving towards trying to place more and more children in kinship care, in the care of people children know, their relatives, and in some cases even close friends. So these are formal arrangements, but they're kinship care arrangements. I mean, we've always had it, but I think states are moving towards doing that more. And some states, many states, I think now, are funding kinship care navigators. So you
Yes.
look at whether those exist in your state. And an interesting question I've had is whether those kinship care navigators are helping those kinship foster caregivers in finding early care and education programs, because it's another thing that they need. And since there is this funded position now in many states, the kinship care navigator would be really interesting to find out, because I think they could benefit from that, the same kind of assistance we've been talking about for other foster parents.
Yes, I'm so glad you brought that up. Yeah. I'm sorry, Nikki. Yeah.
No. Just thinking from the mental health consultation perspective, most of the grandparents that we engaged with are formal, kin care providers, or I think the theme is relationships. So oftentimes, they're seeing our role initially as supporting the teacher, but of course, we're circling back to them each week and talking to them about what's happening in childcare, what's working, talking to them about what's happening at home, any supports that they need. And over time, it can be a safe space to say, I didn't expect to be parenting a young child at this point in my life. Or, physically, I'm having, a hard time keeping up with this very busy, 3-year-old. And that gives our consultants, I think, opportunity to explore with them what services and supports would be of benefit. And oftentimes those aren't conversations that happen in the first weeks, but that can
Yeah.
unfold as that relationship develops.
That's great. I mean, that's the concept of safe space is really an important concept. So thanks for bringing that up. We've got a question about whether or not the data, this is a data question, it is a data reporting question about whether or not the data on participation of children in foster care in early childhood programs and services is reported up federally in any way. And isn't this something we should be looking at as a measure, I would venture to say, of child well-being if we're talking about the big 3 categories of data reporting, safety, permanence, and well-being. So do you guys know if that's being done, or what would you have to say about that?
I think that would be terrific. It's not, to my knowledge, currently a requirement to report on participation in any setting or particular settings. And as you're suggesting, ideally, we'd want to know what kind of setting, what kind of
Yes.
setting.
Mhm.
The only reporting that we mentioned is that reporting that Head Start programs have to do to say how many of their children are in foster care.
Mhm.
The states are required to report how many children involved in child welfare are getting early intervention services. And right now, there are states that are not even reporting that. So
Mm.
have a ways to go. But I think that would be a really excellent requirement.
Yeah. Thank you. Well, this has been a really interesting conversation. I want to thank our participants for your questions, and I want to thank our presenters for your answers and your very thoughtful answers and your presentations as well. I'd like to just do a little round robin here to wrap it up. If everybody would, if all 3 of you would give a little thought to your final thought, something that you would like to leave everybody with. Whoever wants to go first, have at it. And then we'll just kind of go around. There's only 3 of us, so only 3 of you. So, who wants to go first? What is your final thought you'd like to leave everybody with?
So I guess I'll start by speaking to any other folks who are researchers here, and just to share what I've felt really the benefits of research that is engaged in collaboration with state agencies and folks who are out implementing and looking to support children and families. It's I think the most important and productive work that I've had the chance to do as a researcher.
Great. Thank you for that. I'm sure that other researchers are thanking you. Sheila?
I think I would just say that, this is, it seems very straightforward to work on trying to get more children in foster care involved in early care and education. And there really are a lot of opportunities, but it's going to be a multi-year kind of effort, long-term effort, because it's pretty complex. There are lots of different barriers in different systems, and just the very nature of children's experiences and the challenges that exist across all the people involved make it complicated. But hopefully, more states and communities will begin to work on this and then stick with it over time.
Yes, it takes time. It takes time.
I've
Thank
just
you.
been inspired by the passion in the chat. You can see people's heart is really in this issue. And I think that when that's the case, we can find even small solutions, even at very local levels. And so if you're a Head Start director out there and you want to go to your local DCFS office and say, hey, are you satisfied with your childcare options? Is there something we can do to help, do to partner? Like, I think those relationships are key to making change.
Absolutely. Absolutely. Well, thank you. Thanks to all three of you for just a great job. Just a wonderful conversation, great presentations, really important work that you're doing. I want to thank you personally for the work that you're doing. This is it's so important. And so now we're going to just kind of wrap it up. We have a little commercial to give here for the PN3 Exchange. So they want you to join the PN3 Exchange today, which you can do easily online. The Exchange is a communication hub. It's a place where you can meet people, share information, share resources, learn what other folks are doing, share what you're doing. So it's a great resource. And so there's a little invite here. And then next slide. We want to thank you for joining us. So you're going to see a survey, and we're going to ask you, as I mentioned before, to please take just a couple minutes to complete the survey. It's a reflection sheet because we really do want to know how we did and if we met your expectations and your needs, and if you learned something from all of this. All right, so we're actually about a minute before time. Good that we did that. So happy for everyone who came today. There have been, I think, over 300 and some people have been on this call today. So that's just been great. And thanks to all four of you guys. I mean, well, that counts me. Thanks, everybody.